Hello everyone, I'm Dr. Beatrice Hippolyte and this is your world. People with mental health issues, they're so unpredictable. Anything can trigger them.
Yes.
And when whatever that may trigger them at this moment, they're gonna act on it right away. And it doesn't matter if it is like to kill you.
Right.
So it's like they will understand later when they kill somebody. But the moment that they were doing it, they didn't see it that way.
Yes.
They didn't see that they were doing something wrong until after it's actually happened.
Yeah, so incredibly true, incredibly true. But if I could say maybe what I would suggest in terms of how to get things maybe on a better track, or even to just try to prevent, I think that mental health should be a better screening process, and it should really start as part of your care. It should be something that is addressed in terms of whether you're in a clinic, because I feel like a lot of times when you go to a clinic, you might not receive the best care, versus someone as a private doctor that you see. But I think there should be a better screening tool. And I think that programs should be made available, or communities should be made available, just in case. We hand out so many things. And when you, in postpartum, after you deliver baby, you get so many things, a packet of 1 billion papers, you have your birth certificate, you have your pediatric forms, you have all of these things. But I think that it's something that is started earlier, that you do have this community available, because maybe by the time you're in, after you deliver, maybe it could be too late, or maybe I don't even have time to deal with this now because now I have a newborn, or maybe I have a 2-year-old and a newborn now. I don't have time to deal with this. So I think that maybe that should be something that could help in terms of decreasing the incidence or the disparity, the closing that gap of postpartum depression.
During pregnancy, often women go to do their checkup.
In the first trimester, it's a little far apart. As you get closer to delivery, you go. You can be there every week, unless if you're high risk, you might be there every couple of days. It depends. But the first trimester, second trimester is not as often.
Okay.
It's towards the end that it does.
The point that I wanted to make, so when you go to see your GYN, for that routine checkup, so I know they check the baby, whether the baby is healthy or what have you. But at the same way they do that for the baby, they should have checked on the mother too.
Yes.
I understand that you want the mother to be healthy for the baby, but there must be some checkup going on to know whether the mother is healthy, both physically and emotionally.
Yes, yes.
So
and there should definitely be some sort of maybe screening tool. I was actually talking to a provider, a mental health provider that does have that works in OB, like has an OB background, and she was saying that she wanted to, I believe that she's trying to work on a tool to have a screening tool to better assist with that. Her name is Val. She works for Mind Psychiatry. I was talking to her the other day, and she was saying that she is actually working on a tool to help in terms of better screening for anxiety and maybe undiagnosed anxiety, postpartum depression.
During pregnancy or after? Okay.
Yeah,
okay.
Yeah. I believe she's working. Maybe it could be something that's intrapartum and postpartum. I'm not too sure, but I was talking to her about. She was saying that was something that she was looking to do.
Okay.
Yeah.
Earlier you mentioned the cultural impact that the Chinese people sometimes, are facing or dealing with, for not being able to express their feelings or their pain. But Spanish people or Spanish women, they are facing with serious issue culturally as well.
Yes.
Due to language barrier.
Yes.
Because many of them, cannot really express themselves in English, and they may be of assistance or have a great need to receive help. But because they are incapable of expressing themselves, it will be hard for them to get that service.
I mean, yeah, I think in the hospital, I mean, I can't speak for every hospital, but I will say most hospitals do have like a language line phone where you can communicate. Even though you can say certain things, not everything, you know, everybody wants to say to someone that they don't know. It's harder to almost build a rapport with your nurse. A lot of times, you know, I'm there for 12 hours, so it's easy for me to maybe like joke around with you. You get a sense of my personality, I get a sense of your personality because I'm speaking in English to you, you're speaking English back to me. Whereas now if I have a language line and I'm communicating with a third party, even though it's right there, it kind of almost takes that personal aspect away from it, and that might not be as easy for someone to express. Some people are completely open and some people are not. And again, even with that, culturally, likely is not accepted. You're still a stranger to me. Why do I need to divulge information? Or it could be your partner that's there, that's maybe answering the questions for you. I'm asking you, how's your pain? How's this? How's that? And your partner's answering, or your husband's answering and telling me she's fine, she doesn't need anything. You know, so in that, it's a little harder for, you know, even if I have a phone to communicate with you, for me to even understand it, because culturally it might be accepted for the man to speak for you, and you're not able to really express how you're feeling. Yeah.
Let's say, for example, if my husband is answering from me, when you ask the question, will he ask me?
No, I've had so many.
So you ask the question and it just give you the answer without asking me in our own language?
Yes, for example, I have so many times I've had patients that come in and I see that they're in pain and I say, okay, you know, whenever you're ready, it's totally up to you. You can have an epidural that at least will help to take care of the pain from the contraction. And the husband will say, she's not in pain. Not even, forget the translation part. She's not in pain. And I could physically see you're in pain. I can clinically see you're in pain because your blood pressure's up, your heart rate's up. I can see all these signs and symptoms that you're in pain. But one, he's not communicating with you. And even if let's say I take a language on and I have someone communicating, but they may be afraid, and not maybe necessarily afraid because maybe not that the husband is physically hurting them, but just afraid to even say, yes, I'm in pain and I want pain relief, because the husband has already answered and spoken for you.
That's a serious issue.
Yeah.
Why?
And so now I can imagine if I'm asking you, do you have any history of anxiety? First of all, who's answering? And then even if the husband does translate, are you really telling me the truth? And then it's so hard to even try to get the
then in that regard, we need more people, you know, like who speak the same language.
We need more of your kind.
You know, because it's like you said, the person will feel more comfortable. It's like many times when I have Asian clients, so the minute that they come, they're like, oh, you Asian? And I always say, yes, born and raised. So you can see the demeanor will change right away.
Yes.
Because they feel that, hey, I'm home.
Yes.
It's my people.
Yes.
That's the way they know they will refer to you. Oh, you my people. And so they'll feel comfortable.
Yes.
All the nuances and what have you, so you can tackle them. But when you have somebody come with a husband or, you know, a partner, while that person doesn't speak the language, and you have to have that partner answering all your questions, not knowing that whether that, you know, you really being of assistance to that patient, or the person who, the patient is the person who really has the need.
Yes.
You know, to be assisted, and you don't know whether whatever that you do, you are doing the right thing or not.
All right.
The husband said, no, she's not in pain, while she could have benefit from some pain medication.
Right. Right. So like I said, just to like tie it back in, it's just, you can imagine how if I'm asking you about anxiety, if I'm trying to speak to you about postpartum depression, how things might feel, how, you know, the importance of recognizing there's something wrong and being able to seek help. It's even harder to communicate, even if I have, you know, a language barrier phone, even if I have all of those things, because there's still something culturally that's blocking, that I'm not even able to really communicate, or even you're not really even allowed to express yourself and say, I need help.
Wow.
Yeah.
It's a very serious problem.
Yes.
But what about the economic factors? If you were to address that, what will be your point of view?
Economically, I mean, the thing is, unfortunately, that comes down to a lot of times insurance, right? Do I have health care? A lot of times, if you're coming in on Medicaid, Medicare, something like that, you may not even have access to even being able to speak to a therapist, okay? And then the other thing is too is therapy is not cheap, We need more programs where it's more either affordable or even free to be able to receive that type of care, right? There's SNAP, WIC, all of these things that you qualify for because maybe you're not making as much money, you have no job and everything like that. But then where's the mental part of it? That can be addressed for free, or a deep discount or something like that.
But for most part, many people who have Medicaid, if they have a mental health issues going on, Medicaid will pay for it.
Medicaid will pay for it, but I think that in terms of postpartum, it's not that it's Medicaid's a little funny. It's not
even if you are being diagnosed.
Even if you're diagnosed, it's not, I don't want to say it's not as easy to get, but are you devoting the time for it? I think that people who pay for therapy will have an easier time to maybe deal with it versus someone that
out of pocket?
Out of pocket, right. But therapy is so expensive. It's so expensive. If you're sitting down, one, you have to find the right therapist because not every therapist is going to work with you. Two, when you do find the right therapist, I'm sure it's not covered by insurance most of the times. And then you're paying, now you're paying out of pocket. And now imagine if you're on a lower socioeconomical level, you may not be able to even afford it. So now, which care am I receiving? TikTok community, and what if I need medication? I can't get that from TikTok. Maybe now I have to resort to other things, and maybe that could lead to other problems, alcoholism, drugs, or harming yourself, harming your child, like sleep deprivation, all these things come into play. But I think that that there should be more programs available, not only just for people who are maybe, let's say it's not Medicaid, but what if I am working, okay? I'm a nurse, and let's say, God forbid, I fall into this pattern where I need mental health addressed, whether it's in pregnancy or what have you. Most nurses don't have the best insurance, right? Let's say I'm supporting my family, or maybe it's just me and my husband or something like that, and we don't have the money. Mortgages are expensive, so let's say I own a home. I have a mortgage to take care of. Maybe I have a car note. And now the money that I have to spend freely on stuff is not...
Plus a zillion of other bills.
Exactly. I have student loans, So all of these things come into play. And again, therapy is needed, but it's so expensive. It's so expensive. And I wouldn't say to a therapist, you need to decrease your rates because it's important, but where's the give?
Because I may be in need, so I may want that place where I go to therapy to kind of decrease their rate. But at the same talking, they also have responsibilities to taking care of. Whether the place have a mortgage on, or they are paying rent, electricity bill, gas bill, water bill, all the bills plus employees. So they have to pay. So it's like it's a struggle everywhere that you go. So it's not gonna be easy.
I will say a lot of jobs do have some sort of mental health program where you can take part of it, maybe get a couple of sessions free here and there, but it's usually not the greatest either, So again, coming down to pay, I guess, in that sense, because I've had people that have taken part, that I know have taken part in their jobs, mental health program, but the therapist, maybe it helped out for a moment, but it doesn't address a long-term issue. And then I'm back to, can I afford to seek therapy?
It's serious.
Yes.
It's serious.
Yes.
But one thing, there is always gonna be help around.
Yes.
So I may, go to this place and I may not be able to get the assistant over there, but I cannot just say, what, so it's like I'm not gonna get it. So there are helplines that we can call
Right.
to get the information. There are 311 that we can call that can lead us to the direct direction.
Yes.
Because at the end of the day, so I understand, like, hey, Medicaid may not cover this fully, but they may cover it partially. So this insurance may not cover this. So, and hey, you may find a place that can, in order to really assist you, that can decide to bring the fee down just to assist you.
Yeah,
Let's
that's
say
true.
if you were to pay $100 per week, so they're like, you know what? Can you afford $50 per week? And before you even know it, you may get the assistance.
Yeah, that's
But
true.
at the end of the day, so what I will recommend people not to do, not to sit on it.
Right. The best thing you can do for yourself is to take the first step. The first step is what you have to take in order to make any change and make any progress in addressing anything in your life, whether it's losing weight, your mental health, your job. It's not going to come to you like that. You have to take a step. That's very true. Yeah.
And oftentimes you may have family members and friends who would like to support you too.
Yes.
So don't feel ashamed, because if I have a need, I have a need.
Yeah.
So if you're my friend, I'll come to you. So you may not have the financial means to help me, but at the end of the day, you can refer me to somebody else.
Yes.
Don't sit on it. Ask, because, you will always find help somewhere.
Yes.
If you go that way, you don't find help. So keep on asking, keep on looking, keep on searching.
Right.
And plug yourself to people. Go to those churches, and it doesn't matter if it is Protestant or Catholic, because they are churches tend to be great resources, believe it or not.
Yes.
So it's like whatever that you need, you may not be able to find it. You go to that church presbytery and you ask for the information. They may not have it, but they will know where to send you.
Yes.
Do something about it.
Yes.
So anything else that you want to add to that?
No, I think that as, time passes by and that things become more openly accepted, I hope that the disparity and the gap in terms of addressing and dealing with anxiety, postpartum depression, that does close. But just like we just talked about, it all requires you to take a step. And then we listen and we don't judge, right?
Exactly. But one thing, Nurse Becca, with that situation, according to research, women who have pre-existing condition, mental health condition, they are more prone
Yes.
to be affected
Yes.
by this situation that you just mentioned. So in that situation, if I go to the doctor, knowing that I am carrying a child now, I'm pregnant, right? So that will be very important to address or to bring to my doctor attention to say, you know what, I was diagnosed with this and that. So my doctor will know that because I have a past history, then, carrying a baby can put me more at risk.
Yes.
While I'm pregnant and even after I give birth.
Yeah. So I think that a lot of times medically, in terms of addressing that, there are medications that are safe for pregnant moms to take that are teratogenic, so that they don't affect the baby or cross the blood-brain barrier, which is a concern. There are certain ones that do, and so maybe a lot of therapists or providers will not prescribe certain medications if you are of childbearing age, or if you maybe were on those medications before, they will start to taper them down so that it decreases the chance of affecting the baby. But there are medications that are safe to take. So in terms of if you had a pre-existing condition, yes, you are at higher risk, and maybe you do need to be looked at more. Maybe you need to follow up more. A lot of times therapists are involved in that type of care.
Okay.
But again, did you have access to it before? is the issue. I think the bigger issue I would say in that situation.
But in that environment, that the doctor that I'm seeing, the hospital that I'm going to, knowing that I have a past history, should kind of like, set things for me in a way to be well equipped upon giving birth, not to fall into deeper problems.
So a lot of hospitals, part of your admission, when you come into the hospital, we do, as nurses, we have to assess you. And so one of the things that we ask is, do you have a history of anxiety, a history of postpartum depression, even a history of infertility? There's a lot of things in terms of also socioeconomical issues in terms of where do you live? Is it stable? Do you need legal help? And one of the questions that it ends up asking is, does the patient need a social work consult? And you can click off yes. And that's not something I'm going to ask you. I'm going to ask you all those other questions, but the computer's asking me, the system's asking me, does this person need a social work consult? And I can choose to say yes or no. And you may not check off everything, but I will say yes for something, and then a social worker will come and see you during your admission and to address those issues. So I think hospitals do recognize that there is an issue, and does things to address that, to kind of curb that. But also then it comes down to the nurse too. If I have 5 admissions, am I going to be asking everybody those questions? Because I'm just going to keep on clicking no, because I don't want to input further information. So there's a lot of issues.
But that should not be something to take upon you.
It shouldn't.
Not to do.
It shouldn't.
Because you have a large case load.
It shouldn't, but these are things that happen.
Because every patient should, it's wrong though.
Yes, it is
because
wrong.
Every patient should have been seen according to their needs.
It is, but I will say in terms of just
because
being
now you answer no for me. While all 3/4 of those questions could have been yes.
Yeah. But I think that that's something that can happen at hospitals where you may have a lot of patients, especially someone that is working in the emergency room, for example. They're asking all of these questions as well. And maybe if you had a trauma that's coming in, I may not have time to ask all of these questions if there's short staff, if there's all these other things. And so these are things that can be missed.
Then that's another way that hospital need to improve.
And I'm not even saying this as in, this is factually happening. I'm just saying, and just as an example that it can, but this is why to me it's so important for, things like this to be addressed during pregnancy, because if I'm at the doctor's office, not to say that those things can happen, but it's on a less severe case, a less severe situation in terms of maybe I have a lot of things going on in the emergency room. Not that say you don't have things going on in the doctor's office, but it's just less severe. So you should be able to ask those questions. So if it's addressed earlier, even if I miss it, we already have a history. We already know that I may need to pay attention a little more to what this person is saying or not saying in that sense.
Or myself as a pregnant woman, I may not know the type of questions that you should be asking me, but if I know my conditions and I have certain needs that I need to bring to your attention, even though you didn't ask me, but I still can bring that to your attention for you to kind of hey, let me take note on that.
Yes.
As something that need to be considered.
Yes.
Very important.
Yes.
Very important. It's a lot of information. Thank you so much.
Oh, you're welcome.
Now, before we finish, we're not going to finish without you telling us about your podcast.
Oh, sure. Okay. So my podcast is called The Nurse Aspect. It is available everywhere you listen to podcasts, so Spotify, Apple, YouTube. I'm on TikTok. TikTok is a little different just because it's me talking about my real experiences, things that I have a little series called Relatable or Debatable on my TikTok. So it's just me saying things that, can you relate to this or not? And I find that a lot of times often nurses can relate to certain things that we go through as nurses. I'm on Instagram. I take all kinds of questions all day, all night. I'm available at thenurseaspect@gmail.com. And yeah, so it's just me talking to different nurses, different backgrounds. So there's traditional bedside nurses. There's nurses who maybe started out at the bedside, but are real estate investors. And there was nurses that I've spoken to that you're a nurse and a firefighter. So it's just me talking to different backgrounds in the hopes that one, as nurses, we all go through things. I'm sure as everyone goes through things in their own, specific fields. But I just think that nurses, it's just a way for people to have a release, A lot of times we are going through the same things, and maybe we're not. Maybe you want to go into a certain field of nursing. And I've spoken to someone that maybe after listening to the show, you're like, I don't think I want to go into that. Or maybe it's driving you to go into that. So that's pretty much in a nutshell what my show is about. And yeah, so like you said, I started a few months before you, and yeah, it's going.
So it's every week?
So initially it was supposed to be every week, but at this point right now I'm releasing episodes every 2 to 3 weeks right now.
Oh, okay.
Yeah, but there's definitely a lot to listen to, so there's no shortage of content, I would say.
Okay. So, and hey, you just heard Nurse Becca. So go out there, listen to her podcast, subscribe, and
subscribe, ask questions. You don't have to be a nurse. I take questions from anyone. I love talking, and I'm not shy.
Can people ask you health-related questions
you
too,
can ask
since you are a nurse?
But I am a nurse. I'm not a doctor, so I'm not diagnosing anybody with anything. If you want my opinion on something, if I know the answer to it, then I will tell you. But I'm not diagnosing anybody with any type of medical concern. I can tell you what I see at the hospital in that sense. But if I can help you, I'll help you. If I can't, I will say that I can't help you.
Okay, so if I suffer with high blood pressure, and I need some advice on medication and things like that, I can ask you. So you will refer me back to my healthcare provider.
I will definitely send you back to healthcare. I could even refer you to a healthcare provider if you don't have one. But in terms of like what medication I think you should take, no, because at the end of the day, I don't have lab work on you. I don't know. And again, my job is not to diagnose. But if you want a nurse aspect on hypertension, sure, no problem.
Okay.
Yeah.
Okay, it's fair enough. So, darling, it was a pleasure to have you.
Thank you so much for having me.
So when I remember when I showed you that text and I asked you, if you will be available to make it, to the show, and without even thinking twice, you say yes. Why not?
Of course, yeah.
So to finally make it happen. So it's a well appreciated moment for me.
Thank you for having me.
And I believe it's the same for everyone who's watching or listening. Thank you so much for your time.
I enjoyed being on your world.
Okay, so together we're gonna keep on going.
Yes, thank you.
It was with you all, Dr. Beatrice Hippolyte, with Your World.